I'm chairman of Blueprint Louisiana, an organization that was formed in 2006. And we're about systemic reform issues in the state of Louisiana.
And what do your recommendations here today say?
We made 3 sets of recommendations, one that affected health care, higher education, and the other one was general recommendations to the legislature for this impending financial cliff session of the legislature.
What's the bottom line to your recommendations? How much money do you think the state could save or generate?
Well, what we proposed today was about $1 billion in cuts. And it was an opportunity that we believe the legislature should look at if they want to find others that might enhance that or find others that could supplement it in some fashion, then fine, because they're the lawmakers. But we can sure recommend what we think is appropriate. And our suggestions are backed in a lot of research, and the organization has been around to do that for quite some time. Blueprint Louisiana was formed in 2006. It is a nonprofit group. It is a bipartisan group. It's effort-led and supported by community leaders across the state and business leaders across the state. Blueprint's work is to identify and promote practical state government reforms that we can implement today that will improve Louisiana's long-term outlook as a great place to live and to work. In other words, we're focused on creating the state that we deserve. Today, we're unveiling a new list of reform recommendations that have been developed specifically for this year's financial cliff legislative session. Louisiana, like most states across this country, are facing significant state budget shortfall. Estimates of the next fiscal year in the state of Louisiana reflect at the high level about a $1.6 billion budget shortfall. So we have created this new list of reform recommendations because we believe that difficult budget cycles are also good opportunities to implement needed long-term reforms because that also address short-term budget issues. We recognize that budget cuts are necessary, but also know that it matters very much to Louisiana's long-term future as to how those cuts are made. Our blueprint for this year's financial cliff session includes 14 recommendations that collectively can address a very large percent of the state's budget shortfall. We have organized these recommendations into 3 topics, and each group of recommendations would be presented by Blueprint Louisiana Board of Trustee members that are here today. Jimmy Moran will present the first segment, which is the general state government section and their recommendations. Dr. Philip Roseman will present the healthcare recommendations, and Clay Allen will present the higher education recommendations. And so I'll now turn it over to Jimmy Moran. Thank you.
Thank you, Bill. My name is Jimmy Moran. I am a founder of Blueprint and currently serve as its secretary. The new blueprint includes 4 recommendations, general recommendations for state government in the general area. The first recommendation is to open up statutorily protected funding. Every time we have a down budget cycle, health care and higher education take an unfair share of the cuts because there are too many statutorily dedications baked into the state budget. We believe the administration and legislature should target at least $100 million in non-constitutional, non-fee-for-services dedicated funds for elimination. The amount represents just 2% of all protected state dollars in the state budget. The second recommendation is to reduce the number of state workers by approximately 9,500 over the next 2 years. Through this reduction, Louisiana reaches the southern average for the number of citizens served by state workers. And we want to be clear about this fact. It is not possible to rely on attrition alone to achieve this number. Personnel reduction should be made strategically as duplicative and lower value programs are phased out. The third recommendation is to begin reform of our state employee and teacher retirement system. Following the lead of other states, Louisiana should increase the employee share of state retirement benefits and look for opportunities to decrease the administrative cost of these systems. We also believe that Louisiana's retirement system should begin to seriously examine a move from defined benefits to defined contributions or some hybrid concept. The final recommendation is to begin a Smart on Crime initiative that addresses outdated sentencing and parole guidelines. Louisiana currently incarcerates about 40,000 adults. Almost 30% are nonviolent drug offenders who are not eligible for any parole considerations. The annual cost is astronomical. Blueprint believes the Louisiana Sentencing Commission should produce specific recommendations to the legislature for reforming sentencing guidelines, especially for outdated laws on drug offenses. These recommendations should include more parole eligibility and community-based options, which are less expensive and more effective in reducing recidivism. There you have it, 4 recommendations, $362 million plus in savings, in potential savings in fiscal year 2012. I'll now hand it off to Dr. Roseman.
Thank you, Jimmy. My name is Philip Roseman. I'm a cardiologist from Shreveport, a member of the Blueprint board since its inception. There's an African proverb. It's those who choose to sleep when the house burns may sleep forever. Blueprint isn't asleep. In the area of health care, our vision is the same as it was on day one, providing better access to health care closer to home for the people of Louisiana. Our first recommendation is implementation of coordinated care network systems in our state. The establishment of medical homes, a look at regional planning, the expansion of health information technology and managed care. It'll improve our quality and lower the cost of health care. These networks are systems to promote prevention and communication, moving more of the care out of the emergency room into the doctor's office. Since the beginning, Blueprint has the best interests of the people of the state rest in converting from a system where money follows the charity hospital facility to a system where money follows the patient. We've advocated for the end of the two-tiered healthcare system in Louisiana from the beginning. This is the basis for our second recommendation. We must continue to accelerate reform in the Louisiana charity hospital system. With the exception of the 2 medical schools in Shreveport and New Orleans, we should transition state-run charity hospitals to local ownership or public-private partnerships in the different regions of our state. We have some experience at this in Louisiana. The network of primary care clinics in New Orleans, the public-private partnerships in Baton Rouge and Shreveport are examples. Now's the time to think about how we go to scale. There's a nonprofit mantra, it's no money, no mission. If we want to institute the money follow the patient approach, we must have the money to follow the patient. That's the basis of our third recommendation. Maximizing federal matching funds for current state health expenditures. The better we leverage state funds for the 70-30 match, the better we serve our citizens. There's opportunity here, and some of that opportunity is outlined in our report. Our fourth recommendation, a hospital provider assessment. It's another way to leverage state funds for federal match funding. 19 states in this country have established or expanded hospital provider assessments in 2009 and 2010. This is a self-imposed assessment. Louisiana's hospital provider community is driving this discussion. They understand the current challenge, and they're looking out at even a greater challenge in the future. As federal health care reform updates and unfolds this decade, Louisiana may see 500,000 more people with Medicaid as their health insurance, so we must prepare. Blueprint believes when the people paying the assessment want the assessment, the state should consider the revenue-generating proposal in a positive light. Blueprint's last health care recommendation is that Louisiana continue to keep the right balance of institutional care to community and home-based care. 2/3 of the Medicaid budget is long-term care, mental health, and developmental disability needs. Like all of the health care recommendations we've outlined thus far, this is about improving quality, and it's about lowering cost, allowing us to reach more people, better access to care, closer to home for the people of Louisiana. I'll now hand off to Clay Allen to talk to you about higher education recommendations.
Thanks, Philip. My name is Clay Allen, and I am a founding member of the Louisiana Blueprint Board of Trustees. It's my pleasure to offer you 5 recommendations for systemic change in the area of higher education. Our first higher education recommendation is the elimination of programs that do not meet acceptable standards. We believe this is a very difficult budget cycle, and it should be used as an opportunity to raise the bar in higher education. We applaud the Board of Regents for their 2011 report on academic programs, and we encourage the Regents to act boldly to eliminate many of the 450 low completer and duplicative programs, academic programs identified in that report. Blueprint recommends as strongly as we possibly can that the administration, the legislature, and the Board of Regents not apply across-the-board reductions to post-secondary campuses, nor should the legislature attempt to set campus-specific budgets outside of the performance-based funding formula. Our second higher education recommendation is real structural reform. Blueprint believes it is time to re-engineer our whole higher education system with attention to need, demand, and balance statewide. This recommendation includes a number of straightforward structural reforms that should be linked to tuition authority and operational flexibility in a Grad Act 2.0 legislative package that incentivizes regionalism, reorganization, and fiscal performance in addition to improving academic performance. Our third recommendation is to create new management savings and efficiencies. Our higher education systems should spend less on board offices and administration and more on faculty, instruction, and support to students who complete their degrees. Community colleges and technical schools, in particular, should complete the regionalization of back office functions for immediate savings in administrative costs. Our fourth higher education recommendation is more operation freedom for institutions. This recommendation includes a number of additional freedoms that would allow campuses to operate more like a business. We recognize that some oversight is necessary, but Blueprint believes a better combination of autonomy and responsibility and accountability will drive institutions to greater effectiveness. Our final recommendation is to redefine the role of the legislature in setting tuition rates. Legislative control over tuition by a 2/3 vote gives Louisiana the distinction of having the most restrictive requirement in this country. It is no surprise, then, that Louisiana's tuition and fees are the lowest of the 16 southern states. This recommendation includes a variety of specific reforms that offer higher education more freedom to keep tuition and fees within market norms in the southern region.
We think these are the beginning. We need to have long-term and short-term fixes, but it's just the beginning.
If people have questions or would like more information, what should they do?
Number one, they can go into our website, www.blueprintlouisiana.com. Not only can they read about it, they can also join the organization, participate in some of our community workshops we put on throughout the state.